And welcome again to another edition of The Natural Nurse and Dr. Z. I'm Dr. Z, and we're here talking about issues in health, wellness, and alternative medicine today. Glad you can join us and take part of your day to learn and grow and educate yourself in the field of natural and alternative medicine. Remember, you can always get more information on our website, which is drznaturally.com, and naturalnurse.com as well, about our fun shops and things that we're doing, and walks and talks and webinars and all kinds of interesting things, our books. So without further ado, I want to introduce one of my dearest buddies from Naturopathic Medical School, Dr. Kim Vanderlinden. Dr. Vanderlinden is a naturopathic physician who practiced in Vancouver, Canada, as well as a doctor of traditional Chinese medicine. He served as president of many companies in the nutrition and holistic medicine field from 2008 till today, of Hope Science and Early Detection and Periodyne and Enzymatic Therapy Canada. He's working with a supplement called IP6 and is author of the book Too Good to Be True about inositol hexakiphosphate IP6 and its use in the areas of oncology, diabetes, kidney stones, etc. He's also looking at clinical trials using cetylated oils, which we'll talk about that too. I'm real interested in that because of my work in arthritis. And of course, he works with Professor Shamsuddin, developer of IP6, on a early stage cancer screening test. He's humbled and elated that the screening test, after 3 decades of research with more than 10,000 patients and 20 published clinical trials, will be available later this year. This test will save countless lives. Dr. Vanderlinden, are you there?
Good morning.
Hey,
how are you doing?
You're awake. It's a miracle.
Yeah, it's a little early on the West Coast.
So I just want to say that, so Kim and I, Dr. Vanderlinden and I went to school together at Bastyr, and we were actually housemates. So we have a lot of dirt on each other, which is kind of fun. So we're going to share one funny story, maybe. Dr. Vanderlinden would often stumble into class at 8 in the morning and just like pass out on the couch in the back, because we had couches in the back of our class. And so he earned the nickname Crash. The man barely alive. So I don't know how you made it through school, but you actually got 2 doctorates. That's great. Tell us a little bit about your, actually share one fun story about us going to school together that you remember from many years ago. I mean, we actually were celebrating, I think, 30 years out of school or close to it this year.
Yeah. I remember one time we decided to do some fasting. And so we just had fluids we tried to do it for a week.
I think we did it for 2 weeks.
After 4 or 5 days, I remember one time Eugene was sitting down. He got up fairly quickly, and he kind of passed out. And he went, and I don't know if you guys know, but he's a fairly tall guy. He went forward and passed out, hit the wall with his head, and smashed the thermostat. So that was it. That was the end of his fast. I made it a couple of days longer.
Oh man, I tell you. Well, one good thing I think about us going to school is we did try to live naturopathy. We didn't do it as like, oh, we can't get into medical school, whatever, so we're going to study natural medicine. We both had a real interesting, I of course studied with the Jamaican bush doctors in Jamaica and had a whole personal conversion and healing experience with Jamba of the Maroons, and that kind of influenced me to kind of study that in my training in martial arts and Chinese medicine. Was real interested in herbs. My father, growing up in Italy, telling me stories of like when I was out in the farm and getting herbs and things like that, and saving the fig tree and whatever. And then you also have a very interesting background, what led you into naturopathic medicine. Why don't you share that with the listeners, because it kind of dovetails into our topic today, which is studying IP6.
Well, when I was about 12, so like 50 years ago, my mom got cancer, and she was given a few months to live. She had a terminal diagnosis, and so she sought some help from. There's really basically nothing that Western medicine could do for her at that time, and so she, in desperation, she looked at different alternatives, and one of them was we had a naturopath in our town in northern Canada, and he was from Europe, and he was an old PhD in biochemistry, and he just changed her whole lifestyle around, and so for me it was very eye-opening. And then as a teenager, when I was in high school, they got me to in the clinic to keep me busy and let me observe. I got to do a massage, so I was observing this doctor, and there's some remarkable things I saw. And then I started, even then they had some sort of preliminary health food stores. So I used to volunteer in health food stores. So even from a young age, I was always involved in natural health. So it's not that I didn't like Western medicine. I loved Western medicine, but I also saw the value of the natural approaches. And so that's what led me into natural medicine.
And he had your mother do some interesting things, like actually drink liver. Like he was really into the raw foods and kind of like the glandulars. Tell us a little bit about that, because that's kind of interesting.
Well, his name was Dr. Skagen, and he diagnosed my mom. So I have a younger sister, 3 years younger than me, and she had. He diagnosed her saying that her problem started when my sister was born, because she lost a lot of blood in birthing my sister. And so what he did in the middle of this cancer diagnosis, he made her eat, and it was pretty bad. I remember the smell, a pound of raw calf liver a day. And so she would grind it up, try to make a milkshake, mix it with coffee and things. But it was really nasty. But my mother went from being a kind of typically tired and low energy to, middle of end stage cancer, having lots of energy. And that really would help her through this whole thing. And liver, as we know, is one of the best sources of B vitamins and inositol. And it's one of the highest sources of inositol. So what we're talking about today is really a combination of IP6 and inositol. And inositol is the I in IP6. So it's phosphorylated inositol. So she actually was getting enormous doses of inositol, and that really made a difference in her journey. She overcame her cancer, and so it was great. But the smell of so now they have more socially acceptable forms. They have a capsule of organic calf liver you can get. But anyways, that's one of the things he made her do was eating raw liver, and that gave her a ton of energy. And I think really made a difference in her overcoming her cancer.
You also tapped into some Native American shamanism, which is kind of interesting because, I studied with the shamans in Jamaica, the Maroons, and just learned things that really you could not explain with Western medicine at all. How they knew things, and it just seemed to be, that they weren't ignoring the holism of people. The mind, body, and spirit connection, I think, is very critical in medicine, especially in naturopathic medicine.
Yeah, I think my mother saw a shaman, and he was, what I understand now, he was in Wyoming, and his name, I think, Raymond Harris. And I got to see him. He came up to northern Canada one time. He would see a lot of they would do sweat lodges for the Native Americans and Native Canadians, I guess. And she went to the sweat lodge ceremonies, and I remember the time she went down. At that time, I didn't really know. I was only 12. Didn't really understand, that my mom had a few months to live. And she went down to see this shaman, and I kind of thought it was a joke. I didn't really understand it. But she came back, and I remember her oncologist, who was actually a well-known oncologist, said they must have made a mistake on her diagnosis, because how could she be this well when previously, just a month before, they couldn't understand it, or a month before they had a very bad prognosis for her. So the shaman really made a big difference. And then, so they continued to, my parents continued to see or speak at least with the shamans over the next little while. So it was a remarkable part of the story is the Native American shaman.
Yeah, it's very, very important to put that in there. But like you had said before, really good nutrition and using these very interesting and novel phytomedicines and also other chemicals in the body seem to play a role in the cell of the health. Tell us about IP6. When and how did interest in this bee-like vitamin begin?
Well, I got a chance to attend a seminar in Japan, in Kyoto, Japan, and it was about IP6. And I got to meet the chair of the conference, and it was some really well-known professors from all around the world presenting. One of them, I remember, there was Professor Wattenberg, was considered they referred to him as the father of chemo prevention. So he looked for years and years and years of what they could do naturally or not even naturally, but just what could be done to prevent cancer. And at the end of all of this, the one thing he came up with was inositol, which is the base of IP6. So there was Professor Wattenberg. There was another professor who was on the Nobel Committee for Medicine, as an endocrinologist, showing at this conference the role of IP6 in diabetes. But most importantly, I became friends with Professor Shamsuddin from University of Maryland. And I just remember being in this conference. There was about 500 of us. And professor after professor was speaking. And it was like, I couldn't believe it, because my whole journey up to that point was thinking about what could we do to prevent cancer or to treat cancer. And here was a simple B vitamin, inositol, and it had potentially profound impacts on our health. So I was on the plane back. I remember telling and actually our roommate, Gaetano Morello, I was so pumped up.
Gus went too?
Yeah, it was both Dr. Morello and myself.
Wow.
And so I was so pumped up because, the knock on natural medicine is, is it scientific and is it validated? And here was a case where it had profound implications, and at the same time, it was natural and very simple. So, and I got to know that I learned of this professor. He had done some remarkable research, and we could talk about it a little bit later on, but basically he invented a test, screening test for lung, breast, and colon cancer, and also prostate. And, to this day, there is no screening test for lung cancer. And that's why so many people die of it, because they typically find it when a person's coughing and it's already spread, or spitting up blood. So there's no early detection. And so he was the inventor of this test. And, I got to say, you mentioned it earlier, but I'm just so grateful that this test is going to be available to the public by later this year. It's a huge, huge advancement. It's the first time we've had a screening test for lung cancer, which are by far biggest killer, 140,000 Americans a year. it works for breast cancer, and other than a mammogram, there's not really any screening technique. And with a mammogram, it has to be a certain size before they can detect a cancer. So this is even earlier. It works for colon cancer, and potentially it works for. We haven't done clinical trials, but in the lab, it's shown to be really effective at differentiating a large prostate versus a cancerous prostate.
Yeah, we'll get into that in a little while. We want to spend quite a bit of time talking about that because there are some antigenic markers that we know about. We've run, CEA and CA19 and some of these markers, but none of them are really like that horrific as far as pre-diagnostic of cancer. Many of them are like we run them when we know the patient has cancer to see how well the treatment is working, lowering these markers. But this one is interesting, and our colleague and the gentleman who I spent a lot of time studying with over the years, Dr. Peter D'Adamo, he also talks about some of these markers too. So it's interesting that the pathologist doctor that you were talking about before kind of discovered those things. But we'll get to that in a second. Let's get back to talk about IP6 and how it was discovered. Now, it was interesting. When I was reading your book, I was like reminiscing of our class in nutrition where they were saying that phytic acid, which is another name for IP6, was just like an anti-nutrient molecule. It was bound up all your minerals, and it was found in cereals and fiber and things like that, and was something that wasn't really good. So it seems like there's been a change of heart in looking at this phytic acid, and then I guess that's the same as IP6. Am I getting it correct?
Yes. Well, phytic acid without the calcium magnesium is called, that's phytic acid. When you add the minerals back in, that's what occurs naturally. They call it phytate. So phytic acid is when the calcium magnesium drops off and it becomes acidic. But if you put in the minerals, then it's phytate.
Right.
So that's it was discovered and they considered it an anti-nutrient because it was always binding minerals. But in fact, what happens in the body, we absorb it is phytate, and we get those minerals. So we get the benefit of the calcium magnesium. It's one of the, magnesium is our biggest challenges because of there's such, between magnesium and zinc, those are two biggest nutrient deficiencies in the U.S. for minerals. And so it actually is a good source of those. So it's not an anti-nutrient, it's a super nutrient, in fact.
So the phytic acid was discovered to be pretty good, and that's where they got the idea of the IP6. And I know there was this whole study that the Finns and the Danish did about fiber and colon cancer and things like that. And there's different, good things about fiber. For instance, like, I know that the bacterial microflora, the probiotics in our body can take some of the fiber and convert it into butyrates and some of the short chain fatty acids, which feed the colon cells. But you're talking about a whole other mechanism of how fiber can help with cancer through the IP6 molecule. Talk about that Finn and Danish research.
Well, actually, it started in South Africa. So
okay.
In South Africa, the blacks had 90% less colon cancer than the whites. But then they realized, so they first thought it was genetic, but then it was only the first generation blacks in the city who would have the protection. So if a black was living in the city for 3, 4, or 5 generations, they had the same colon cancer incidence as the whites. So then they knew it wasn't genetic. So they looked at the diet. In South Africa, they eat corn or maize, right? And rurally, so that's their traditional diet. And so that's where they got the hypothesis that fiber protects against colon cancer. So it made sense because they're consuming huge amounts of fiber by basically living off corn. Then that was in the 1960s, and they still have that dogma today. People still think, fiber is how you prevent colon cancer. But in the 70s, that's when they looked at the Finns and the Danes, and the Finns had half as much colon cancer as the Danes, and also breast cancer, but they ate half as much fiber, they ate half as much fiber, but had half as much colon cancer. So there's something wrong with that hypothesis. Well, go forward to the 80s, and Professor Shamsuddin, so he invented the test for, like we're talking about, for colon cancer. So he said, I'm going to look at this, and he sped up. They have ways of speeding up the rate of cell division. So they took a bunch of mice, basically mice and rats, and he sped up the rate of cell division, and then he gave them IP6 or a placebo, just straight fiber. And the ones that had more IP6, that had fewer tumors, less metastasis, they lived longer. So then he knew that it was not the fiber itself, it was the IP6. And so the Finnish people, they eat a lot of oatmeal, a lot of oats, versus the Danish people, it's more wheat. Well, there's more IP6 naturally in oats than there is in wheat. So despite eating literally half as much fiber, they were getting 20-30% more IP6. So there was a dramatic difference between those two populations. And so that's really was the start of this whole thing, was trying to explain why, despite eating more fiber, the Finns were the Danes were having more colon cancer.
So let's actually break the molecule down a little bit. So we know they consider inositol, which is, I guess, the backbone of the IP6, as like a B vitamin, but I guess it's not really a B vitamin in the sense. Vitamins are I know you have a chapter on your book, like what makes a vitamin a vitamin. So, some of these things are, like, I'll give you an example, like vitamin D is really a, neurosteroid. I don't really know if it's a vitamin because we can make it, but yet the name stuck. But tell us a little bit about the B vitamin inositol and how it's related to IP6 and the structure and kind of what it does in our cell.
So if you think, you can start it with sugar, with glucose. So glucose is a molecule that our bodies convert into inositol. But we only get a little bit, right? So we produce a little bit naturally of the inositol, and it's like a circular vitamin. And then what happens is the body adds phosphate groups to it. So you can think of inositol as IP0. There's no phosphate groups. And then you can have IP1, IP2, IP3, 4, 5, and 6. So you can add these phosphate groups to the molecule. So we make a small amount, just like vitamin D, what you're saying, with the sun, with sunshine, we make a small amount. But we need to get some from our diets for optimal health. So neither of them are truly vitamins, because the definition of a vitamin is something the body doesn't produce on its own. But the reality is that only a small amount is produced. And so what IP6 is a phosphorylated inositol. And inositol itself is a very interesting molecule, because inositol, it's a B vitamin that, ironically, is required by law to be in baby formulas, because without inositol, cells don't develop that well. So, it has to be in baby formulas, but as soon as, once we're off baby formula, the government, nobody talks about it anymore. Excuse me, but it's almost literally a requirement by law. So it's a very, very important molecule, but there's very little information out there about it. Like, for instance, they haven't even said an RDA. So we know that inositol is important, but they don't take it much beyond that. It's just one of the B vitamins.
Right. So you could make it from the carbohydrates, but it's like one of those conditionally, um, I forget what they call them, but essential nutrients. I know it makes cell membranes inositol. There's some studies that show that it helps with insulin and blood sugar control. And I know inositol is really important for chemical messages in the brain, like serotonin and dopamine. That I know for a fact too. We know it's kind of important in all those things. I've given it to people with polycystic disease, diabetes. It's a real, I mean, I think it even has a lot of antioxidant value too, right?
Well, especially it's a mild antioxidant, but as far as antioxidants go, the IP6 is very potent because once you add the 6 phosphates, there's a room for 12 electrons. There's 12 electrons, so that's when you can have a calcium magnesium bound to it. So IP6 on its own is a very, very potent antioxidant. So we think of it in terms of anti-aging. For instance, it helps with, studies have shown it prevents telomere shortening, right? So that's one of the ways we age is we measure it by the telomeres. So for anti-aging, but basically as an antioxidant, it has, a dozen free electrons. So it's, they've compared it. One example is they compare IP6 to green tea extract. And so they have these models where they check the rate of colon cancer in rats and mice. And IP6 is much stronger than the green tea extract. And so, but together actually they get more profound effect. So the antioxidant effect, or what we often think of as anti-aging effect, is very strong.
Now, also, it seems to affect the rate of cell division. So that could be how it seems, one action that it could be effective against various cancers. So how does it kind of work with that?
So the patent, actually, there's a U.S. patent on it for boosting your immune system. So that's a little bit different because it shows it boosts natural killer cells, or the type of cells that specifically the white blood cells that target viral cells, which is important right now dealing with the COVID, but the viral cells and cancer cells. So it has that aspect of the immune function. But I think the most interesting part for the cancer is that and there's a number of mechanisms, but the one of them is it causes the cells to mature. So you can think of a cancer cell something like a teenager. They like to replicate a lot, right? So but what IP6
and don't listen, and they don't listen much, right? Too. That's another thing with cancer in teenagers. They like to replicate, and they don't listen.
Oh yeah, they don't listen. So what this does is causes cells to get old, and we have a lifespan. Each cell has a lifespan. So if they get old and they die, then that's what happens. And so that's what normally happens. So cancer cells divide before they have a chance to mature. The technical term or the medical term is apoptosis, right? So it induces apoptosis, which is just basically it just lives its life out. And so they tested it for IP6 there's a standard test the National Cancer Institute uses. It's called a 60-cell assay, and they measure it basically the chemotherapy agents, what effect it has on cell growth. And when they did it with IP6, it inhibited the growth of 59 out of 60 cancers. But it's easy to inhibit growth of cancers. You just throw in some bleach or some poison, right? So yes. The advantage of the IP6 was that it was inhibiting cell growth, but it wasn't causing any damage, right? So it's completely natural. So there was no side effects of it. So it was completely non-toxic. So by inducing apoptosis, it was causing the cells to mature, and when it does that, when the cells mature, they're not in the replication status.
Right. And then I'll ask you one more question, then we'll take a break after you finish. Your father had like a cardiovascular event, and he used IP6. Tell us a little bit about that whole thing. I met your dad several times. Actually, I remember staying at your house for a week during spring break many years ago.
Oh, he came up to Vancouver,
yeah.
So my dad, I was with him, and he's Dutch, and they have a saying about the Dutch: shoes wouldn't head wouldn't listen. And so I was with him, and he had a stroke, right? He went blind in one eye, and I was like, "We got to go to the hospital. Got to go to the hospital." No, I'll be okay. Eventually, he's so stubborn. Eventually, I got him to go to the hospital. So we get to the hospital, and fortunately, the stroke resolved. So in the optic nerve, so his vision came back. But anyways, when he went to, they evaluated him. His carotid arteries were blocked, and one was 90% and one was 94% blocked. So it was really bad. So he ended up having the carotid arteries cleaned, but they do one at a time. So the neurologist, I remember, spent 2.5 hours with my dad. It was great. He had all the tests done independently, and then he spent 2.5 hours, did a complete evaluation to see if he's okay for surgery. So this is when he was about 65, and now he's 85. So they went through, and they cleaned out the one. And then you're supposed to come back, because you can't do both at the same time. So he's supposed to come back for the second carotid procedure 3 to 6 months later. But he wouldn't go back because he was scared of getting a stroke from the surgery, because there's 1 in 16, about a 6% chance of stroke from the surgery itself. Anyways, after 3.5 years, we finally convinced him to go back. And then the same neurologist spent an hour and a half with him. Again, all the tests done independently outside. And they said, the one we did 3.5 years ago, it's like we did it yesterday, because normally they recalcify, right? Because the trauma to the tissue. He says, I can't believe it. He says, it's the first time I've ever seen this. There's no damage. And the other one, there's no change. It's normally would progress. Because there's a calcium inside there, and then there's a endothelium over top of the calcification. So he said, this is the first time I've ever said it, but we're not going to do the second operation and he knew that I was, I told him he's taking the IP6, and right after he had the first operation, we started the IP6 on him. And he says, it must be that, he'd never seen it before, where the one doesn't recalcify and then the other one doesn't progress. So for my dad's case, the IP6, and he also had a cancer that went away. So, but just in terms of the cardiovascular, one of the effects of IP6 is that it comes in with calcium magnesium, gets absorbed, and then the body gets the calcium magnesium, and then the IP6 goes through the blood vessels, and it picks up and drops off minerals. And what it's doing is, if there's calcium exposed in the artery, then it can chelate it or bind it. And then this just basically goes out, the calcium eventually drops off, and then the IP6 gets, it goes out your urine, a little bit of it. So anyway, so that's what it did. It kept his arteries clear, and still, it was 20 years ago, and my dad's still a going concern.
Fascinating. We're going to take a quick break and play our natural medicine chest. And when we return with Dr. Vanderlinden, we'll be talking more about IP6, but mostly focusing on this very interesting test that can detect cancer even before it starts. And this is something that is just so groundbreaking and earth-shattering that we need to spend a lot of time talking about it. And this is going to be available to just every doctor and around hopefully across the land in a year or so. So stay with us, folks. Don't touch that dial.
On this edition of the Natural Medicine Chest, we'll discuss the folklore, history, chemistry, and medicinal applications of the common kitchen herb, thyme.
The common culinary spice known botanically as Thymus vulgaris is only one member of a large genera which includes over 400 species and even more varieties. The Thymus genera is originally native to the Mediterranean region and is a perennial plant which grows wild in usually dry, sandy soil, green heaths, and grasslands. Thyme is a prolific, fragrant, creeping ground cover and often displays an attractive spray of flowering branchlets spanning the spectrum from white to violet.
There is considerable debate amongst historians as to the origin of the name thyme. Some believe it to be from the Greek thymon, meaning to fumigate or to burn a sacrifice, because it was used as a sweet-smelling incense and also to keep pests and venomous creatures away from the Greek home. Others believe it came from the Greek thumos, meaning courage or energy, perhaps because it has a reputation of being used by Greek warriors for courage and was bathed in and used as a beverage for invigoration. The Egyptians used an herb called tham, which we believe is Thymus vulgaris, to mummify their dead. The principal chemical constituents of thyme are the volatile oils consisting of phenol, thymol, and carvacrol. A 1977 article in the scientific journal Chemical Abstracts revealed that thymol's antimicrobial activity is 18 times more powerful than phenol. Phenol is a major antiseptic used in commercial germicidal cleaners like Lysol. Thymol is one of the most potent antimicrobial substances known and far surpasses even the strongest antibiotics. It has been illustrated in the Journal of Chemistry and in the Merck Index of Drugs and Chemicals to destroy parasites, worms, fungi, bacteria, mosquito larvae, and many viruses.
The pharmaceutical and cosmetic industry is privy to the important medicinal effects of oil of Thymus vulgaris. It is ubiquitously found in gargles, cough drops, vapor rubs, and many mouthwashes. Oil of thyme is to be used, albeit very sparingly because of its potency, as a gargle or mouthwash for sore throats and inflamed gums. Because the volatile oil is expelled via the lungs and kidneys, naturopathic physicians use it for upper respiratory infections and urinary tract infections. If you're in the midst of a cold and are lying in bed with too much thyme on your hands, try making a thyme tea made with just a few teaspoons of thyme to a cup of boiling water. It's an excellent diaphoretic because it causes the body to perspire profusely. Thyme also possesses an excellent carminative and antispasmodic effect, helping in poor digestion, flatulence, and intestinal gripe.
So, listeners, if you're feeling ill, thyme heals all wounds. Remember to reach for that thyme in a bottle the next time you open up the natural medicine chest.
Natural Nerds, and we thank our engineer for playing that great show on Natural Medicine Chest. Came our book, by the way, and we're back with Dr. Kim Vanderlinden, who now is doing a lot of work with IP6 and this very interesting test that is pre-diagnostic of cancer. So welcome back, Crash. What's up? So anyway, that's a great story about your dad. It's funny. Today, I have a consultation with a guy that is considering doing some type of chelation therapy with a holistic medical doctor, and I'm going to recommend some IP6 as it helps chelation. I remember us talking a long time ago, and I had a guy that was, and I think you were here at a conference, 2004 or something like that, and I picked you up and we hung out in New York. But he had hemochromatosis, a lot, iron overload disease, and you were saying that IP6 is one of the few things that can help that, besides giving like a phlebotomy all the time.
Yeah, so that there's an interesting thing is that this binds the minerals, and so one of the things it can do with excess iron, it's obviously exposed in the bloodstream. So in terms of chelation for too much iron, that's definitely an option.
Now, at the beginning of our show, you talked about our great professor, your friend. Tell us a little bit about Dr. Shamsuddin and how he went on to discover this very interesting test for precancerous diagnosis, which has to do with the Thompson-Fridrichsen antigens that are expressed on the cell surface. Tell us a little bit about that for the listeners.
So what he did was, when he started his career in medicine, there was a project where when they were harvesting organs for people, that he was investigating the origin of cancer. So what would happen is, in these otherwise healthy people, there'd be a team of physicians taking the organs, but he would be taking tissue. He'd be taking colonic tissue. And then, as a pathologist for colon cancer, specialty in colon cancer, he was looking at the tissue from healthy people versus the colon tissue from cancerous patients. And what he noticed was, if you look at the cancers of the tumor, most of the pathologists at that time would look at the tumor and say, well, this is cancer. They weren't looking at the tissue beside it. Well, he noticed that there was some differences in what was otherwise considered healthy tissue next to the tumor. There was differences in that tissue compared to healthy tissue, and that those differences occurred in the tissue beside the tumor and in the tumor itself. So, in fact, he invented 5 different tests to identify this tissue. So, so what happens is, let's say you breathe in asbestos, and it affects the cells in your lung, but a few spots might turn cancerous. But actually, a lot of that area would be considered precancerous, right? So he was able to identify markers that were actually precancerous and correlate them with the cancer. And so they've done about 20 or 25 studies with about 10,000 patients. One of my favorite studies was on lung cancer, and what they did was they looked at, and you can see it on the website cancer.us. So not .org or .com, but cancer.us. And what they did was they found, I think it was around roughly 200 patients. About 90% of them, they were able to, with 9% accuracy, find the cancer. So they identified 9 out of 10 cancer patients. But then they had the false positives, what they call them. But the false positives was about another 10% or something, where they didn't actually have cancer, but they showed up positive. Well, within by the next checkup, I remember I think it was 21 people who had false positives. 15 of them turned out to have cancer. So they found it pre-cancer. So, that's a remarkable, because, all of our studies are looking at trying to find cancer early, which is really difficult. But here it is, they were able to find it before it formed. So, and they've done it also for colon cancer, where, the person's tumor is removed and they tested positive before. And then they went in with a colonoscopy and found the actual tumor, removed the tumor. And then a portion of these people will still test positive for this marker. It's an abnormal sugar. They test positive, and then they follow them. And a very high percentage of these people go on to develop cancer, a recurrence of the cancer. So it's good for monitoring, after surgery once a cancer is removed. But so the beauty of this test is it can find abnormal changes. So you can't diagnose a cancer because it could be a precancer, but it basically it tells you when there's tissue changes occurring. So when this abnormal sugar shows up, that there's some at least precancerous status of the cells. So that it tells you, for instance, there's so many people die of lung cancer because there's no screening test for it. So this will, you can go to the doctor's office now and potentially get a screen, and then it'll tell you, do you need further evaluation? There's a problem right now for instance, breast and lung. The test is, mammogram or a chest CT exam. Well, chest CT exam is a good way to find a lung cancer, but we don't do it because it's like 70 X-rays. So who wants to go and get 70 chest X-rays, once a year, every second year? So, and mammogram is about, on average, about 4 chest X-rays. So you don't want to, give the unnecessary radiation to the breasts or to the lungs. So this is a way of finding it early. Or it doesn't find a cancer. It just tells the physician that there's these cellular changes that they should do further evaluation.
Right. Plus the fact that these CTs and whatnot, they only detect large tumors, like this, what do they say, the size of a period or so, or maybe a little smaller. And by then, that's millions and millions of cells that have already gone haywire. So this is very interesting to be able to predict that.
I mean, the mammogram is getting better, but it used to be that it has to be a millimeter or 2 in diameter for it to be able to pick it up. Well, I think this is like 5 years ago, I heard the stat. By the time it's that size, that it's been there for 8 years, right? Because if you think how small a cell is and divides, once a month or whatever, and it takes a lot of divisions to get to the point that it's actually, that you can actually see it on a scan. So this will tell you early.
Right, and that's when naturopathic medicine seems to work best.
Well, that's when Western medicine works best too, because a good example is colon cancer. If you find it before it spread stage 1, they just remove it, and you have a 95% chance of a 5-year survival. But if you get it stage 4, it's already spread, you actually have a 5% chance of 5-year survival. So it's a dramatic difference in what stage you find a cancer. So the beauty of this is it alerts and people think lung cancer, they're not thinking about if they're a non-smoker. But actually, 15 to 20% of lung cancers are non-smokers. So there's over 140,000 Americans. By far the biggest killer is lung cancer. And about 15, 20% of those are non-smokers. So that people are literally blindsided because they're not even looking. But actually, that's one of the biggest killers is lung cancer of non-smokers. So whether you're a smoker or not, you still need to be screened for lung cancer. And so now is the first time ever that we have this technology.
Are there different, again, and by the way, I stand corrected, it's Thompson with an E, by the way, Thomsen, Friedrich antigen, Friedrich, not Friedrichsen. As the tumor-associated molecule that remember Dr. Diadamo when I was doing residency in his office talking about that the cells, because a lot of times these are detected by, special lectins bind to these, like kind of like Velcro binds to these receptors. These receptors are little sugars that stick out the end of a cell. So you were telling me that the cells kind of change their sugar pattern in a way when they become precancerous or cancerous, and then this test is able to pick up that sugar pattern. Fascinating.
Exactly. So as a cell changes, starts to mutate, even when it's precancerous, one of the things it produces are these atypical sugars. And so this test basically identifies this sugar.
Is this an invasive test, Dr. Vanderlinden, or is it going to be hopefully easy for, they don't have to be in the hospital for days doing this. This is a pretty simple test, right?
Oh, it's completely non-invasive, which is really nice. So it's completely non-invasive, and you can do it in the doctor's office. So it takes about 15 minutes. I mean, you got to collect a sample, for instance, for lung cancer, you just have to spit, right? You're not having to do anything invasive. You got to bring up some deep sputum. It takes about 15 minutes, and so you can get those results before you leave the office. So, if a lady comes in and is wondering about, screening, and it should be part of an annual exam, right? Because the reason that you go to the annual exam and check your cholesterol and check your blood pressure, etc., is so you get a jump on it. So you can, you can better manage a condition if you find it early, right? So the problem is we don't screen for a cancer because we didn't have a test up till now. So now this will be should be part of your annual exam, for adults at least, should be part of the annual exam. And the nice thing is you go to the office, it's not going to cost much, and they can screen. And before you leave the office, the doctor will tell the woman, maybe you should be thinking about a chest X-ray or a CT exam or a mammogram or whatever, because if these sugars are present, the chances are greatly increased that you might have a cancer. So, because women are kind of, in breast cancer, for instance, they're in an awkward position, because what happens is 1 out of 8 women get breast cancer. So if you're the other 7 out of 8, you're going, well, if I get a mammogram, maybe increased radiation can cause some damage. So a lot of women don't like getting mammograms. But now, if it tests positive, there's a really good reason for you to get that mammogram. So I think it's going to lead to more mammograms, because there's a good reason to get that mammogram now if you have these atypical sugars.
Right. And are there certain groups of patients that these tests will benefit the most? Give us some stats about, what's going on with cancer in this day and age. There's a lot of people, that's for sure.
Yeah. Well, the biggest killer is heart disease, cardiovascular. That's 650,000 Americans. Cancer is close second with 600,000 roughly every year. Of those, the big four, which are about half of that 600,000, is lung cancer, 140,000, colon cancer, about 50,000, breast cancer, about 40,000, and prostate cancer, 28,000. So those are the 4 big cancers that account for about half of all the cancer deaths, approximately. So this test will screen for those 4. It'll theoretically works for other cancers as well. You can do for uterine cancer, but we already have pap smears, and those are pretty good. It works theoretically, well, not theoretically, it works for pancreatic cancer, but the testing of that, you need to have an endoscopic procedure, so you need a gastroenterologist, so that getting a sample in that case is not easy. But for the 4 main cancers, the colon, lung, prostate, and breast, for those 4 cancers, it's very, very easy to get a sample. It's non-invasive. So that, I think, it's going to take a huge, well, if I think in terms of the number of lives saved, I think this is the biggest advancement in medicine since 1928. 1928, was penicillin. So it's like 90 years ago almost. So, or 92 years ago. So, you can't overstate the importance of this test, because the number of lives that could be potentially saved. This is an enormous advancement in medicine in terms of lives saved, because now for the first time we can screen and find those cancers early.
What's the actual test called, and can our listeners go to a website and read about it and then request that this test be used by their physician if the physician doesn't attend the conference or know about it? I mean, this is sometimes medicine's grassroots. The patients actually teach me a lot about what's going on too when they come into my office.
Yeah. So there's been the 2 websites that I have. One is Hope Science, hopescience.com. That's for the IP6. And the other one is a product called Active Again. And then the other one for the cancer testing is cancer.us. So hopescience.com or cancer.us. And you can read the stories. Cancer.us has got a bunch of the clinical trials on there. So you can, I made it so that, a non-medical person can understand it, but it also has the actual papers there, several of the papers. So then the doctors can go through and read the actual procedures and how they work and things. But it's relevant. The part that's really hard for people to understand about this is so simple. You know, everyone thinks of cancer as being very, very complicated, and it is. But in this case, I guess his brilliance of Professor Shamsuddin, he found something that's really, really simple and simple to test for. And it's by doing basically for 10 years. He was doing these the autopsies for 10 years. So it's a simple now, but it's true brilliance of how he actually figured this out. Because, you know, a lot of doctors would have seen the tissue beside the tumor, but never thought to think, is there some tissue beside there that's going to give us clues about the actual tumor? And so it was just the fact that, you know, he pursued this for literally for years, looking to see if he could find some marker. And like I said, he invented 5 tests, but this is the one that was the easiest and the simplest. And what we've seen from the tests, it works about 80 to 90%. So there's 2 parts of accuracy. One is if you find sensitivity, if you find it. So it's about 80, 90% sensitive. So that tells you accurately if you actually have a tumor. And then from the same time, you want to make sure that not everyone tests positive, the ones that aren't, don't have a tumor. And again, it's about 80, 90% sensitive, specific. That's called specificity. 80, 90% specificity. So, it's overall the accuracy is 80 or 90%, whether you have it or you don't have it. So it's not 100%, but it can't be 100% because it's finding precancer as well as cancer. So it's a pretty remarkable advancement.
Right. Well, thanks very much, Dr. Vanderlinden. We're looking at the hour and we've run out of time already. It's just such a fascinating discussion. Thanks for teaching our listeners about the benefits of IP6, and keep on the lookout for this great screening tool for cancer. We'd like to have you on again at some point, maybe talk about more arthritis and some of the other things that you're doing. So let's stay in touch, and we'll let you go back to sleep. We know it's early on the West Coast there.
All right.
All righty. Have a great one, and thanks very much again. And listeners, thanks very much for tuning in, and stay healthy, folks. Health is wealth. This is Dr. Z signing out. Bye-bye. Take care.